Endobronchial ultrasound is now widely used for staging the mediastinum in cases of lung cancer to determine whether mediastinal lymph nodes are involved with cancer or not. Initially it started small with a number of experts developing expertise, and gradually it spread, and now we've got probably 100, 120 units across the country, across the UK in fact, doing endobronchial ultrasound. And as it's spread, it's very important that we try and have high quality standards, and so that patients going through these procedures meet, we have the highest possible chance of accurately staging the mediastinum. So from the initial studies we did, the ASTA study and other cohort studies that were done, there was some guidance put out about the targets we should try and achieve. The Manchester group led by Matt Everson has also written a commentary on the standards we should try and achieve in different cohorts of patients. And that's all out there and published for people to look at. And what we did was we looked in our own service prospectively, looking at all the cases we do for staging the mediastinum to say, okay, these are the guidelines that have been set down. Can we actually meet them in real life? Is it possible to do it? So essentially we've audited, prospectively audited our data, and we've shown that, yes, we are an expert group at doing it, but it is possible to meet these criteria in everyday life. It is important that you, when you biopsy these lymph nodes, you then get adequate follow-up. So you either get surgical confirmation or clinical follow-up confirmation in order to try and as accurately as possible determine whether you've got a true positive or a false negative or so forth. But it can be done. So essentially we found with about 160 odd cases that we staged that, with a prevalence overall in our population of about 56% for mediastinal malignancy, we could accurately stage the mediastinum about 90-91% of the time, which is about as good as you're going to get. None of these tests are perfect, but if you can hit about 90%, so 9 times out of 10 you're getting it right, that's a pretty good standard. So we're now very keen to work with many other groups to try and bring up the standards right across the country, so everyone is sort of performing on a level playing field.